Hello, welcome back. We're talking today about psychological health and, in particular, treating depression. The initial quiz you took asked if you're feeling depressed. And if you said yes, I recommend you take the full depression screen or PHQ-9, which I provide as a resource in this lecture. How you score on that depression screen will give us a clue to the severity of your depression and what treatments will be most effective. A score less than 10 suggests mild depression. A score of 10 to 14, moderate depression. A score of 15 to 19 is moderate to severe depression, and a score of 20 to 27 is severe depression. We'll look first at the evidence. This was a large systematic review and meta-analysis. It showed that depressed people had a 71% greater chance of dying than people who were not depressed. And on average, that meant 10 years of life lost for people with chronic depression. Now, how exactly can depression lead to death? Now, the obvious answer would be suicide. People are taking their own lives. But in fact, that only accounted for 1 in 5 of the premature deaths. The others were attributed to lifestyle factors. So people who are depressed are less likely to eat a healthy diet, engage in regular physical activity, and are more likely to use tobacco. People who are depressed are also most likely to suffer from social isolation. This goes to show that it's not only the severe depressed who take their lives that are accountable for the increased mortality with depression. It can be milder depression leading to behavioral changes or social changes in level of social interaction that can account for poor health outcomes. So what have we got to treat depression? Well, I'm going to go through several slides here, and I recommend you refer back to that PHQ-9 we discussed. If your score is 10 or above, or you're thinking of hurting yourself, then I recommend you seek immediate medical attention from a qualified healthcare provider. The first tip for depression is think about depression as the consequence of being bored. So when we are bored, when our minds are not engaged in a current activity, in something that captivates our attention, an area called the default mode network can be seen to be activated on MRI. The default mode network is the voice in our heads that tells us, that thinks about the future and about the past. And often anxiety about the future or worry about the future or rumination about the past lead to anxiety and depression respectively. So if you think about depression being the consequence of not being engaged in the present, the goal then is to find a way of being engaged in the present. And a very well-respected technique for this is called flow. And I highly recommend this book by Mihaly Csikszentmihalyi. Flow is a description of what people who have optimal experiences in all walks of life are able to achieve. There's a common recipe for finding flow in your day-to-day and in any moment in your life. The common elements are described in the book, but in short, they're setting a clear goal, having it be a challenge that matches your skills, and an activity that gets immediate feedback. You can apply this to any activity in your day, and you can improve your mood at any point in your day by focusing your attention on something that enables you to be able to lose yourself in the experience. Some examples are cooking, reading, listening to audiobooks, going for a walk or bike ride, meditating, yoga, conversations with others. Many of these are physical in nature, and that's because when we are exerting ourselves, even walking, we can't help but feel the bodies that we're inhabiting. And it's a lot easier to be present when you're actually challenging your body at any activity.